One. It's another episode of Social Distancing at the Chamber, also known as Happy Hour with Hammer. My name is Garrick Taylor. As always, we are joined by the CEO of the Chamber, Glenn Hammer. Glenn, good to see you again.
Good to see you, Garrick.
Special guest today, Glenn. Yeah, that's right. Glenn, special guest today, Dr. Kelleher. She's the Chief Quality and Safety Officer at Phoenix Children's Hospital. She's certified with the American Board of Pediatrics, trained pediatric hospitalist with Phoenix Children's. She's been there 12 years. Dr. K, I bet this seems like dog years right now, doesn't it?
Yeah, I mean, it's a little crazy right now, but thanks for having me. I'm really excited to be here.
Yeah. All right. Before we get into, we wanted to have you on to talk about not only current events, but also very prominent rankings that PCH received in the U.S. News and World Report rankings. But before we get into that, let's do big picture stuff. Why is it important to have a quality children's hospital in a community like Phoenix?
So we, I think, are fortunate in Phoenix to have our hospital. Obviously, we really want to be seen as a resource in the community. We want to be a place where families feel comfortable and they know that when they come, they're going to get high quality care that is safe and evidence-based. And so, we really feel and hope that the community sees Phoenix Children's as a resource, and that it helps attract families to the Valley, and that families are excited about moving here, knowing that if their kids get sick, we'll be there for them.
Yeah, for sure. I know that Glenn has been a user. I have been a user, and thank goodness you're there. We'll just say that.
Well, I will certainly say with my dad hat, how fortunate we've been to have Phoenix Children's Hospital accessible, and the stories that we're telling, I would say probably virtually everyone in our social network has a similar story. So Doctor, I just want to first just thank you for what you have been contributing to the community for many years.
Oh, no, thank you. I mean, like I said, I feel fortunate to work at Phoenix Children's. We have a great team of people here that hopefully, families see as a resource and friends and partners in care.
We certainly do. Doctor, we're obviously right now in the middle, or I'm not sure exactly where, but we have a global deadly pandemic going on. Mm-hmm. How has this affected Phoenix Children's, and particularly given that it's a different age group that you primarily focus on?
Yes, so I would say we are full steam ahead as it relates to COVID-19. We are very similar to other hospitals in the Valley in that we have really changed some of our safety practices to help keep our patients and families safe, in addition to our employees safe. And so that includes things like masking. All of us here at Phoenix Children's wear a mask when we're out in public. I don't have mine on right now because I'm in my room by myself, but we really, employees are required to wear masks anytime on campus. We also are requiring our patients and families to mask when they're on campus. And this, the protection goes both ways. We want to protect those most vulnerable in the population. We also want to protect our staff and families because in particular in Arizona, as everybody is aware, COVID-19 is really peaking and surging for us at this point in time.
Yeah. Well, let's talk about that patient group that you see. We hear that kids are not affected to the extent that older adults are, or individuals with underlying health conditions. So first of all, I'd like to hear if that's been your observation, if that's really the case. But also, you mentioned masks on campus. Should kids be wearing masks in social settings or out in public? I'd love to hear your thoughts on that.
Yes, so the Centers for Disease Control have recommended that every person age 2 or older should be wearing a mask when in public. That's the guidance that we're following here at Phoenix Children's. And so, yeah, it's my stance that if we're out in public, we really should be masked, even for our smaller children. Obviously, sometimes that's not doable, and given, given person's underlying medical condition, sometimes that's not the best idea. But when possible, if needing to go out in public, we should be masking. To answer the first part of that question, we are seeing kids being affected a little bit differently than adults. So we know that adults, and in particular the elderly, have been the most significantly impacted with severe respiratory problems and respiratory failure. We know that kids are getting this infection, but they're not as adversely affected for the most part, as a general rule of thumb, which is great for our pediatric population. But we know that they're getting the virus, and they probably are helping to spread the virus in our community, which again makes the masking piece and the even more important for our kids who are out in the community. But we do see a couple of unique things happening with kids. So I know lots of people in the news have heard about the multi-system inflammatory syndrome. We are seeing that, and probably more to come. We know that that's a condition that actually happens after a pediatric patient is infected with COVID-19. And so we anticipate that we'll see that a little bit more in our community in the next month or so, given that now we're having active infection. But yeah, for the most part, kids aren't as greatly impacted as adults, but we do have a smaller subset of pediatric patients who are ill with COVID-19.
And just before we pass it to Glenn here, that inflammatory condition, it's been reported that that's still rare. Has that been your observation?
Yes, I would agree. That's exceptionally rare. I don't want families to worry that, their kid will have this inflammatory condition if they contract COVID-19. It is exceptionally rare. But if in fact, their son or daughter do contract that, we feel confident that we're able to provide high quality care here at Phoenix Children's for that condition.
Thank you, Doctor. Now to the U.S. News and World rankings. Just incredible accomplishment that Phoenix Children's achieved a national ranking in 10 specialties. Can you talk a little bit about that? That seems really quite unbelievable. I'm not surprised though, but it's an amazing accomplishment.
No, I mean, I am fortunate in that I'm getting to talk about it today, but it is the hard work of hundreds of individuals at our hospital. We are exceptionally proud of the care that we provide, and in particular for U.S. News, it really is a measure of the type of care, the type of quality care that you provide. Are you providing safe care? Are you achieving high outcomes? And so we are very proud that we were ranked in all 10 specialties this year. And I think that speaks to the care that every patient receives at Phoenix Children's. So U.S. News looks at 10 specific specialties, but I think for us, what I'm most proud of is not only were we ranked in all 10, but hopefully, families will feel safe and secure knowing that every patient who comes here is going to get 10 out of 10 care, not just those that, have a medical condition that fall in one of the 10 categories where U.S. News looks at.
So I didn't even realize that. So it was a clean every single category.
Yes.
Wow.
Yeah. So exciting for us. I think it's a testament to the hard work that hundreds of people put in every day. It's a testament to our leadership for recruiting top-notch talent to our hospital to be able to provide that type of care. And so really, I think it's, something that we're proud of, but it's more so that all patients, really receive top care here.
Dr. Kelleher, there are some great children's hospitals around the country, and Phoenix Children's is obviously one of them, but what are some of the notable programs at your institution that help you stand out from the rest?
Yes, so this year, specifically as it relates to U.S. News and World Report, our neonatology group had an increase in their ranking. They've kind of moved up the rank list. Our other centers of excellence include our neuroscience department. So we collaborate with Barrow at St. Joseph's and are able to offer therapies that attract people from around the globe to come here and see our surgeons and our neurologists to help with some of their neurologic needs. We also have a strong orthopedic surgery department that is robust and performs a lot of procedures. We partner with Mayo to help provide some of the more intricate procedures when it comes to, bones and nerves. And so we are proud of our collaboration with other hospitals in the Valley to help advance care and provide really very specific, intricate care for patients who really have very limited options of where they could get this care.
Excellent.
Doctor, when kids come through the doors, they have a health problem. Sometimes it's very serious. Families may be under stress, and probably more so because of the circumstances, health and economically related to COVID-19. What are some of the supports that Phoenix Children's offers to families of its patients?
Yeah, so I think one message I definitely want to get across is that we are open for care. I know that it is at times scary to think about going into the community, but we don't want families to have their children go without the care that they need. So we are offering lots of telehealth visits, so families don't even have to leave their homes. But if your child is not doing well and needs emergency services, we want you to come to Phoenix Children's Hospital and receive that care. We feel like we have policies and procedures in place that will protect patients, their families, our staff. But also, to I think get at more what you're asking with that question, we really are fully focused on family-centered care. The patient and the family are at the center of everything that we do. And that is noticed when you walk in our facility. It's bright, it's cheerful. It doesn't really feel like a hospital sometimes, which I think helps our patients who have to be here quite a bit. But we also offer things. We have excellent child life specialists who help us with everything, whether it's prepping for an imaging study or a test or helping our patients get through procedures. They really are keyed into it. Every patient's needs to help get them through. We have reduced food meals in the cafeteria. We have a family advisory council where we have parents of our patients come and give us feedback on how we can do things differently and make it more enjoyable for families, but also, help improve the care that we provide. Actually, we in the last couple of years opened up a new cardiothoracic or cardiovascular intensive care unit, and we actually redid some of the construction elements based on feedback from our families. So we really try and incorporate families in everything that we do, and we're going to lead you through any complex diagnosis or therapy, making sure that you have all of the information you need to make the best decision for your child.
Well, I feel just better after talking with you. So I always want to, I do actually. I don't know if that's outside your scope, but it's just, it's incredible what you've achieved. And I just, bottom of my heart, just really appreciate it, particularly during this difficult times, what Phoenix Children's Hospital offers to the children and the families of this community.
Well, thank you very much. Like I said, we're exceptionally appreciative of our community. I think we receive so much from our community. We have great donors and volunteers and just people who go above and beyond also to help us. And so thanks to our community as well.
Absolutely. Glenn and I and everyone at the Chamber spends a lot of time thinking about how to improve the state's competitive standing, enhance its quality of life. And I will tell you that your institution is really a jewel in this community and statewide, to be able to tell people that are looking at Arizona as a possible place for expansion or investment that we've got a world-class children's hospital. I tell you, it's a great thing to put on the cover of the brochure.
Yeah, I mean, like I said, we want to be that resource. We want to have businesses be able to thrive and flourish in the Valley, and having a hospital like Phoenix Children's, where families feel comfortable that if anything were to happen to their children, they'd receive top care. You all are trying to recruit top talent. We're doing the exact same thing. We want to continue to partner with folks in the community to help elevate just everything, you know, in the Valley. And so thanks to you guys as well for helping us do that.
Thank you. Glenn, you want to take us home?
Just many, many thanks, Doctor. Thank you for being with us, giving us some very important information, and congratulations on the well-deserved rankings from U.S. News. And please be well, and thank you for keeping Arizona's children safe and healthy, and helping so many families across the state.
Thank you very much. Yeah, stay safe, everybody, and wear a mask in public.
That's right. Thanks,
we will
doctor.
do that. You're the doctor.
You're the
Thank
doctor.
you.
Doctor's orders.